of dental care here in the UK, and to talk us through it all is the TalkTV reporter Nick Ellerby, who has been pleasantly reclining in a dental chair for most of the day, it seems. Nick, how are you doing? Have you got your gnashes looked at yet?
Yeah, I've had plenty of looked at. My ear, Tony's seen me right, and yeah, pretty much been relaxing this afternoon in this lovely pink chair.
Good. I hope Tony gives you a badge and a lollipop when you're finished for the day. So let's talk through the figures that have been released today by NHS Digital, showing that, well, far fewer people are going to the dentist, even in a 2-year period, than pre-pandemic levels.
Yeah, that's right. So the data is for NHS England. It's shown that compared to 2019-20, before COVID, there are 5.6 million fewer treatments this year. And actually, that when you get down into the data, you find that 2.6 million fewer adults have been seen in the last 12 months than in the year before the pandemic. And it's because there are just fewer dentists working in the NHS, 533 fewer than in 2019-20. That's despite Rishi Sunak promising that he was going to put 500 more into the system. And some parts of the country are worse affected. Usually you find it's the rural areas, especially places like Bolsover in Derbyshire, Ashfield in neighbouring Nottinghamshire. There's 12 or 13,000 patients to every one NHS dentist. And in the county of Norfolk, currently, you cannot find an NHS dentist anywhere, even for emergency treatment. So you're finding, I'm here in Sharrow Dental in Chelmsford, and people are making a 4-hour round trip to come to places like Tony's practice to get basic treatment. Tony, just tell me, why is it that people cannot get emergency treatment at the moment?
Well, the problem is that an awful lot of patients want emergency treatment. They want to access a dentist. Now, looking at it from the dentist's perspective, if we see a new patient for an emergency, we have to go through a number of things. We have to do a medical history, we have to do an examination, we have to do investigations, we have to then discuss treatment possibilities with the patient, maybe a root filling, maybe an extraction, and then we have to do the treatment. All of this takes anything from 30 to 40 minutes. Now, in that time, we get the big amount of about £25. Now, if we were to do 2 or 3 fillings in that time, or 1 filling in that time, we get £70 or £80. So the dentists don't want to take on a lot of new patients' emergencies because it clogs up the system when they could be doing other things, could be treating far more patients. Within that 40 minutes, they could maybe see another 5 or 6 patients. So this is the problems. There's no reward for actually seeing the urgent care patients. And they are very often the ones who are also high need. It often isn't just one problem. It's often a whole series of problems. So this is where we need the National Health Service to set up a proper scheme for access for emergency patients, so that not only are they treated and got out of pain, but actually there's a follow-up for the treatment so it doesn't happen again. Because so often we see the same faces come back every 6 months, every 12 months with pain in a different tooth, and we have to go through the same process again. So what we need is an access scheme which actually looks after this.
Well, there you have it, Alex. I mean, it's a shocking problem. It's been a problem for a long time, and it's getting worse. The government's own Health and Social Care Committee have called the situation totally unacceptable in the 21st century. So the government, Rishi Sunak, need to get on with it and put some smiles back on English faces.
Yeah, don't they just? Nick Ellerby, thank you so much. Fantastic reporting all day there on the dental crisis affecting the United Kingdom. Let's now talk to Dr. Ben Atkins, who's past president and trustee of the Oral Health Foundation. Hi, Dr. Ben, how are you today?
I'm very well, Alex. How are you keeping?
Good. And I went to see a dentist yesterday and my toothy pegs are in good nick as well, I'm happy to report. But that's not the situation for a lot of people, is it? And what I really want to ask you, actually, is what is behind this? Because we're all born with one, well, once we get our adult teeth, one set of teeth we have to carefully look after for life. We all need to see a dentist regularly and a hygienist regularly in order to do that. And yet it's the one big chunk of healthcare in this system that is so hard to access and so hard to afford. How did we get into this mess?
Sadly, the data, it comes as no surprise that dentistry is really struggling. We've gone through we can talk about Brexit, we can talk about lots of different factors, but we need a system that benefits the patients and the dentists and the government alike, and we need that evolution. This has been COVID threw a massive spotlight on a service that was quite frankly broken. And as the government itself has said, they need to invest in more dentists, because with Brexit, we lost. I think it's a lot more challenging to become a dentist in the UK now, especially with foreign graduates. So there's lots of, it's multifactorial. And I think we've got a lot of big change to happen to my profession before those solutions actually happen. It's key for patients to understand that each area does have an emergency dental service that is it could be access driven rather than going to maybe individual dental practices. So it's key to go to maybe dental. We always advise our patients phone 111, and that's an access service. There's two different types of dentistry. There's your regular dentistry, like you've just been to today to get your teeth pegs checked out, or there's the urgent dental care, which is really important to make sure you understand, catch things early.
And I mean, how can we actually encourage more dentists to get back into providing NHS care? Because it seems to me if they have a choice, they'd obviously rather be in private practice than working on behalf of the state for potentially less.
I think we've also had a massive increase in the patient's awareness of more aesthetical dentistry, more dentistry done for the looks of your teeth rather than maybe for the health of your teeth. So the NHS is there for your health, and often the very lucrative aesthetical treatment that we choose to have done rather than maybe is quite necessary is more attractive to dentists, especially young dentists qualifying. They want to spend hours doing their beautiful creation, whereas that's hits our profession very quickly over the past 4 or 5 years, and we haven't got the same numbers replacing those dentists in the health area. So we need a new contract that actually balances those and massively increase the number of dentists qualifying.
Is essentially the method that the government should put in place, train and retain, by both making it more profitable for dentists to stay practicing in the NHS, but also saying, look, if you've trained in this country, you have to serve a certain period of time. You have to dedicate a certain number of hours a week to NHS dentistry.
I wouldn't force dentists to do that, because if you suddenly say, I mean, I worked in the NHS for 25 years. So if you suddenly say to me, Ben, you force people to do that. We're already locked into doing dentistry for a year after qualifying anyway. But if I said to for example, every journalist, you've gone to university and studied journalism at university, you must pay that back by locking you into a certain job. We can't do that. We've got to have these options. We've got to make the NHS dentistry really attractive to work in. And actually, it is attractive to work, and if it's done correctly. I'm a true believer in the NHS, but at the moment, we need to change the views. We need to change the views on society as well, on people being responsible for their own mouths, making sure they're really clean, because dentistry is fully preventable. If you brush your teeth twice a day with a fluoride toothpaste for 2 minutes, you're going to stop the majority of stuff that I'm going to do health-wise, without question, but doing it properly. So it's locking in values for everybody in society and probably change some views.
Yeah, I couldn't agree more. Interesting, my mum used to run the dental helpline for Gloucestershire. If you needed to find an NHS dentist back in the day and you happened to call up the Gloucestershire helpline, you'd have spoken to my mum, Leslie Phillips. I know, ding dong. Thank you ever so much for that, Dr. Ben. Brilliant to hear your thoughts on quite how bad dentistry is and how it's got here. You know, one thing that I do think, if you're going to have state-run medical care and then you're going to say to people, well, you know, the government's controlling this, but you don't have to stay in it. You can just do NHS dentistry for a year and then go and do the jazzy white teeth thing. I mean, that doesn't really work, does it? That might cut in the private sector, but if something's government controlled, it's got to deliver for the people. We've got some breaking